Gentlelady, Ms. Cathy McMorris Rogers.
Thank you, Mr. Chairman. And Madam Secretary, you know, although we were told repeatedly that if you liked your health insurance plan, you'd be able to keep it, we're now being told by the government that they have determined many existing plans to be lousy, subpar. In reality, this law is becoming quickly less about helping Americans purchase affordable coverage and more about compelling millions of Americans into a struggling Medicaid program. In my home state of Washington, 90% of enrollees will be in Medicaid. 16,000 of them coming into a program that they were already eligible for. Colorado, 89%, Kentucky, 2/3, Maryland, 97%. And these are states that are already struggling with their budgets, wondering how they're going to cover Medicaid, which is, as we all know, for the most vulnerable population. So isn't it true that in states like Washington, they're going to have new, unexpected costs associated with a dramatic influx into Medicaid?
Well, Congresswoman, the Medicaid expansion provision of the Affordable Care Act is...
Are states going to face new costs?
The federal government pays 100% of the costs of newly insured for the first 3 years and gradually reduces that cost to 90%.
These were people that were already eligible. And we know that 2 out of 3 doctors don't accept new Medicaid patients. We know that current provider rates are going to drop at the end of 2014. So isn't it true that existing Medicaid enrollees are going to further compete for scarce resources in these states?
If the citizens of Washington who are signing up were eligible for Medicaid, they certainly will be entitled to enroll in Medicaid now. The newly insured will be fully paid for, and doctors have additional
that the most vulnerable in this country are going to lack access to the care that they think they're going to receive. And I know time is short.
I think that's absolutely true. And in states that are choosing not to expand Medicaid, it's particularly dire. So I would love to work with you on
Medicaid
expansion.
Finally, I just wanted to inform the Secretary. You told us several hours ago when the hearing started that the website was down. If you look at the screen, several hours later, healthcare.gov is still down. You promised this system would be ready on October 1st. You're clearly wrong. So before I leave you today, I would just impress upon you this is more than a broken website. This is a broken law. Millions of Americans are getting notices their plans are being canceled.
Gentlelady's time has expired.